Welcome to this pharmacology quiz on Beta Lactam Antibiotics, part of our Pharmacology Quiz series. In this video, we will review key drugs used to treat bacterial infections such as pneumonia, urinary tract infections, meningitis, and skin infections. The quiz contains 10 recall-type multiple-choice questions. Each question has 5 options, followed by the correct answer and a brief explanation. The video will pause for a few seconds after each question to give you time to attempt the answer before the correct option is revealed. So, let's get right into it. Question 1. Which mechanism of action best explains the bactericidal effect of beta-lactam antibiotics? Option A. Inhibition of transpeptidase and prevention of peptidoglycan cross-linking. Option B. Inhibition of 50S ribosomal subunit protein synthesis. Option C. Disruption of bacterial DNA gyrase activity. Option D. Inhibition of folate synthesis at dihydropteroate step. Option E. Direct disruption of cytoplasmic membrane phospholipids. The correct answer is option A. Inhibition of transpeptidase and prevention of peptidoglycan cross-linking. This is because beta-lactams bind penicillin-binding proteins and block peptidoglycan cross-linking, leading to cell wall instability and bacterial lysis. All other options describe mechanisms of different antibiotic classes, such as macrolides, fluoroquinolines, sulfonamides, or polymyxins. Question 2. Which of the following statements regarding the pharmacodynamics of beta-lactam antibiotics is incorrect? Option A. They exhibit time-dependent bactericidal activity. Option B. Their efficacy is related to the duration that drug concentrations remain above the MIC. Option C. They require high peak concentrations to achieve their effect. Option D. They demonstrate synergy when combined with aminoglycosides. Option E. They are less effective against bacteria that are not actively dividing. The correct answer is option C. It requires high peak concentrations for effect. The explanation is that beta-lactams exhibit time-dependent killing, where efficacy depends on duration above MIC rather than peak concentration. All other options correctly describe key pharmacodynamic properties of beta-lactam antibiotics. Question 3. Which beta-lactam is most resistant to penicillinase-producing Staphylococcus aureus? Option A. Penicillin G. Option B. Amoxicillin. Option C. Piperacillin. Option D. Flucloxacillin. Option E. Ampicillin. The correct answer is option D. Flucloxacillin. This occurs because flucloxacillin is a penicillinase-resistant penicillin designed specifically for staphylococcal infections. All the other options are susceptible to beta-lactamase degradation by penicillinase-producing organisms. Question 4. Which drug is not a beta-lactam antibiotic? Option A. Imipenem. Option B. Ceftriaxone. Option C. Aztreonam. Option D. Meropenem. Option E. Vancomycin. The correct answer is option E. Vancomycin. The reason is that vancomycin is a glycopeptide antibiotic that inhibits cell wall synthesis by a different mechanism than beta-lactams. All the other drugs listed belong to beta-lactam subclasses such as carbapenems, cephalosporins, or monobactams. Question 5. Which of the following combinations is not a true beta-lactam antibiotic paired with a beta-lactamase inhibitor? Option A. Clavulanic acid with amoxicillin. Option B. Sulbactam with ampicillin. Option C. Tazobactam with piperacillin. Option D. Avibactam with ceftazidime. Option E. Cilastatin with imipenem. Correct answer, option E. Cilastatin with imipenem. This is because cilastatin is a renal dehydropeptidase I inhibitor that prevents the enzymatic breakdown of imipenem in the kidneys. It does not inhibit beta-lactamases. All the other options contain true beta-lactamase inhibitors used clinically to protect beta-lactam antibiotics from bacterial enzymatic degradation. Question 6. Which antibiotic is most appropriate for atypical pneumonia caused by Mycoplasma pneumoniae? Option A, amoxicillin. Option B, cephalexin. Option C, azithromycin. Option D, flucloxacillin. Option E, piperacillin. The correct answer is option C, azithromycin. This is because Mycoplasma lacks a cell wall, making beta-lactam antibiotics ineffective, while macrolides inhibit protein synthesis and are active against atypical pathogens. All other options are beta-lactams that target cell wall synthesis and therefore lack activity against Mycoplasma. Question 7. Compared with penicillin G, which drug has broader gram-negative coverage but remains acid-stable for oral use? Option A, penicillin V. Option B, ampicillin. Option C, benzathine penicillin. Option D, axicillin. Option E, nafcillin. The correct answer is option B, ampicillin. The explanation is that ampicillin is an aminopenicillin with improved gram-negative coverage and sufficient acid stability for oral administration. All the other options either lack broader gram-negative activity or are not suitable for oral systemic use. Question 8. All of the following statements about cephalosporin generations are correct except Option A, first-generation agents mainly target gram-positive organisms. Option B, third-generation agents penetrate the cerebrospinal fluid well. Option C, fourth-generation agents have strong gram-negative activity. Option D, fifth-generation agents provide coverage against MRSA strains. Option E, second-generation agents lack all gram-negative activity. Correct answer, option E, second-generation agents lack all gram-negative activity. Second-generation cephalosporins have improved gram-negative coverage compared with first-generation agents, and therefore do not lack gram-negative activity. All the other options correctly describe the typical characteristics of the different cephalosporin generations. Question 9. Which antibiotic is not effective against methicillin-resistant Staphylococcus aureus? Option A, vancomycin. Option B, linezolid. Option C, daptomycin. Option D, flucloxacillin. Option E, ceftaroline. The correct answer is option D, flucloxacillin. This occurs because MRSA produces altered penicillin-binding proteins that resist all standard antistaphylococcal penicillins such as flucloxacillin. All the other options retain activity against MRSA through alternative mechanisms or modified beta-lactam structures. Question 10. All of the following statements about beta-lactam pharmacokinetics are correct except Option A, they are primarily eliminated by renal excretion. Option B, they often require dose adjustment in renal impairment. Option C, they can penetrate the cerebrospinal fluid during meningitis. Option D, they are extensively metabolized by the liver. Option E, they generally show low protein binding in most cases. Correct answer, option D, they are extensively metabolized by the liver. Most beta-lactam antibiotics are excreted unchanged by the kidneys and undergo minimal hepatic metabolism. The other options correctly describe the typical pharmacokinetic properties of beta-lactam antibiotics. The quiz is now complete, and thank you for taking part in this session. Be sure to drop your score in the comments so we can see how you performed. For deeper understanding, revise this topic using Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary as key references. Any guideline-based points mentioned in this video are aligned with the BNF for clinical accuracy. Subscribe for more high-yield pharmacology quizzes and learning content.